healthcare reform in 2014. Citizens will be required to have acceptable coverage or pay a penalty of $95 in 2014, $325 in 2015, $695 or up to 2.5% of income in 2016. Families will pay half the amount for children up to a cap of $2,250 per family. After 2016, penalties are indexed to Consumer Price Index. Workers who are exempt from individual responsibility for coverage but don't qualify for tax credits can take their employer contribution and join an exchange plan. Companies with 50 or more employees must offer coverage to employees or pay a $2,000 penalty per employee after their first 30 if at least one of their employees receives a tax credit. Waiting periods before insurance takes effect is limited to 90 days. Employers who offer coverage but whose employees receive tax credits will pay $3,000 for each worker receiving a tax credit. Insurers can no longer refuse to sell or renew policies because of an individual's health status. Health plans can no longer exclude coverage for pre-existing conditions. Insurers can't charge higher rates because of health status, gender, or other factors. Health plans will be prohibited from imposing annual limits on coverage. Health insurance exchanges will open in each state to individuals and small employers to comparison shop for standardized health packages. Credits will be available through exchanges for those whose income is above Medicaid eligibility and below 400% of poverty level, who are not eligible for other offered acceptable coverage. Medicaid eligibility will increase to 133% of poverty for all non-elderly individuals to ensure that people obtain affordable health care and the most efficient and appropriate manner. States will receive increased federal funding to cover these new populations. An annual health insurance provider fee will be imposed across the health insurance sector according to insurers' market share.